Hello everyone, this is Dr. Sushma Sarilla, consulting homeopath at Fidicus Homeopathy. Today we are going to discuss about a very important topic called as vaginal candidiasis. So why are we discussing about vaginal candidiasis today is because of its prevalency rate. Globally, 50% women have likely to have suffered with this vaginal candidiasis at least once in their lifetime. So if we are talking globally, 50% is too much. And not only that, the irritation and the symptoms associated with vaginal candidiasis make the work-life balance really problematic. So let's dive into the topic to know more about vaginal candidiasis. So what is vaginal candidiasis? Vaginal candidiasis is a fungal infection. So this is opportunistic infection. So what do you mean by opportunistic infection? That means this yeast, which is Candida albicans, which is present near the normal vaginal flora, it is present, but due to the good pH level or the acidic pH level in the vagina, this usually does not affect us. If there is any alteration in the vaginal pH, then this will affect or this will cause symptoms. That is nothing but vaginal candidiasis or vulvovaginal candidiasis. So let's get into the signs and symptoms of vaginal candidiasis or also called as vulvovaginal candidiasis. We will see through the pictorial representation. As you can see in the picture, the main problematic part of this vaginal candidiasis is the irritation. It is the itching and also the burning near the vaginal orifice and also itching and also burning sensation while passing urine, severe burning sensation or severe itching sensation soon after intercourse or during intercourse, and this burning sensation can go up to more than 2 to 3 hours even after the intercourse. So there is itching, there is burning while urinating, and also characteristic of this Candida albicans is that the discharge, and there is also pain associated with it. Some people may feel burning sensation, some people may feel pain during intercourse. So what is the discharge like? As you can see in the picture here, see, this is cottage cheese like appearance. Like if you crumble paneer or cottage cheese in some liquid, in some gelatinous liquid, or curdy like appearance is like the characteristic feature of this Candida albicans discharge. So the white discharge or the vaginal discharge that you see is cottage cheese like, which is associated with the symptoms that I've already told you, like itching and burning and pain during intercourse. And some people will characteristically have, as you can see in the picture, this is the vaginal discharge, and because of this burning sensation and this itching sensation, the vulval part, that is the external part of the female reproductive system, is also swollen and also might become red in color. Now let's get into the investigation part for this vaginal candidiasis. As soon as you're experiencing these symptoms, when you consult a doctor, the first thing they would do is ask you about the symptoms and do a physical examination. That means they will examine your vagina. And after that, even if they are not able to confirm, they will do a wet mount. So what is a wet mount? As you can see here in the picture, they will take a drop of your vaginal discharge, they will put it under a cover slip along with some other liquid, and they will view in the microscope for better understanding of the problem. And also not only that, if the wet mount is not suggested, sometimes they will be suggesting culture so as to know which kind of species is affecting your vagina. And also vaginal pH testing is very important because alteration in the vaginal pH will only cause this bacteria or this yeast to flare up in the vaginal part. And PCR, which is polymerase chain reaction, to know specifically what kind of species is affecting or causing these symptoms. Additional tests, HbA1c and immune function test. Why do you have to conduct HbA1c is that people who are already suffering from diabetes mellitus or who do not know or undiagnosed cases of diabetes mellitus can have a recurrent vaginal infection. To get to know if this vaginal recurrences or vaginal yeast recurrences is because of diabetes, we have to get HbA1c tested. And also low immunity or people who are under immune suppressions also or immune suppression therapy also suffer from recurrent vaginal candidiasis. So to know if it is because of low immunity, we have to do this additional test. Now let's get into the structure and function of female reproductive system and know more about the vagina, so that we will know what is the problem occurring and how is the problem occurring. As you can see in the picture, this is female reproductive system, and this is the uterus, this is the cervix part, and this is the vaginal part. Vaginal part has folds in it, it has 3 layers in it, And because of the folds, whenever you're pregnant and delivering the baby, the folds will expand so that the baby will come out. So the vagina will have normal flora. Like for example, if you take our gut, there are certain bacteria which are common to our gut and also good for us. In the same manner, vagina will also be having certain bacteria, but they will not be affecting us. Why? Because of the vaginal pH. Vaginal pH is slightly acidic in nature, so that the bacteria will not infect us even if they are present there. Like same as the skin. There are bacteria, there are yeast, or there are other substances on the skin, but we are not being affected by it because there are no cuts or there are no burns on the skin. Same way goes with the vagina. If it is healthy and the hormones are in normal level, there is nothing to worry, and these bacteria are commonly present in the vagina. It is only when the hormonal disruption occurs that this yeast or this bacteria grow inside the vagina. Now let us understand about the risk factors for the occurrence of vaginal candidiasis. The first one being hormonal changes. Remember that the vaginal pH, the uterine lining, and everything inside the female reproductive system is affected by hormonal changes. Any disruption in the hormones can cause an alteration in the vaginal pH, which leads into bacterial or these yeast growth, which can cause vaginal candidiasis or any other infection. Weak immune system. The body is inbuilt to fight certain bacteria. When this immunity goes down, then these yeast infections or these bacterial infections will be very, very recurrent. Diabetes. Same goes with diabetes as well. If you have diabetes, then the occurrences or the reoccurrences of this vaginal candidiasis, or it can be any other allergic diseases, allergic rhinitis, or any other symptoms associated with low immunity will be recurrent in your life. Vaginal douching. What do you mean by vaginal douching? That means cleaning of the vagina with certain liquids. So many people will do this vaginal douching very, very commonly, but remember, by washing up the vagina very clearly with some liquids will make the vagina very sensitive, and it will alter the pH of the vagina, which can lead into yeast infection. So if you're cleaning the vagina too much, then that will lead into infection. Tight clothing. Tight clothing will irritate and also restrict the blood supply, which will lead into differences in the vaginal pH, causing vaginal candidiasis. Irritants. If you're using any soaps or any body washes or any private washes which have high fragrances in them, then that can also alter the vaginal pH, make it more dry, and that can cause vaginal candidiasis. Now let's get into the causes or the causative organisms which cause this vaginal candidiasis or this vulvovaginal candidiasis. The main culprit is Candida albicans. This is the main species, but sometimes even other species can cause this, like Candida glabrata, Candida tropicalis, or Candida krusei. All of these can cause, but the major one or the most common one or the most prevalent one is Candida albicans. Now let us get into the body changes part, that is what happens when this vaginal candidiasis is occurring in the body. So first thing is the causative organism. So whenever, remember this causative organism or this Candida albicans, it is commonly there in major percentage of people. So when does this affect is because of the normal flora disruption. That is, for example, if you take a gut, there are some good bacteria in the gut. When these good bacteria are destroyed by higher use of antibiotics or because of any diseases, then the bad bacteria will flourish. So good bacteria are very important for your gut bacteria. Same goes with the vaginal health as well. There are certain bacteria which are present near the vagina, and when this normal bacteria are destroyed because of a higher use of antibiotics because of any disease or because of too much of vaginal cleansing or because of hormonal disruption, this normal bacteria or this normal flora is destroyed. Then this Candida albicans or the Candida species will grow inside. Fungal morphology. Remember that this yeast or this Candida albicans is spore-like structure or it is round structure. It will change its morphology into a hyphae or like filament-like structures to get attached to the vaginal skin or inside part of the vagina, and then they will start reproducing or then they will start multiplication, and by that multiplication, that is adhesion to the vaginal epithelium, and then they will completely multiply and grow and cause these symptoms, and the body will start fighting it. Whenever the body is fighting it, you will have this inflammatory mediators releasing. What is inflammation? That is, inflammation is like seen through signs like heat, or it can be redness, or it can be any sort of swelling. So the outer part of the female reproductive system, that is the vulva, there can be redness in certain people, that can be heat, that can be itching, and there can be burning. This is all a part of the inflammatory response that is happening inside the body. Now let us get into the conventional treatment part. So what is conventional treatment? Conventional treatment can also be called as allopathic form of treatment or western form of treatment. What is the first thing a gynecologist will prescribe you when you are suffering from vaginal candidiasis? Primary thing is topical antifungal treatments like clotrimazole. So these creams, they will tell you to apply near the vaginal area so as to decrease the symptomatology and also fight against the bacteria. So what are the problems with it? Because it is inconvenient to apply, first thing. And second thing, because of the side effects like local irritation, they can be burning sensation, they can be itching at the application site. Remember, you're already suffering from itching or burning, and on top of that you're applying a cream. It will be very problematic to do your daily events. If this is not subsiding the infection, then they might give you oral antifungal medications along with topical medications. So this oral antifungal medications have a bit of side effects attached to them. That is, they can have severe pain. Certain people will experience pain in their stomach region, and also some may experience vomiting, or they can experience nausea. Some people experience headache, and in rare cases they can experience dizziness. But these antifungal treatments, they will only treat the fungus. They will make sure that the whatever symptomatology is there, that is being reduced. There is no treatment for the immunity problem that you are suffering or the hormonal problem that you are suffering. Even if you are suffering from hormonal changes, after the antifungal treatment, you can again have a reoccurrence because of the hormonal changes. And what do they give for hormonal changes? They give synthetic hormones which have their major side effects. So if you want to choose a proper medication for this vaginal candidiasis and also treat the hormonal system or this hormonal imbalance, you have to choose, or you can choose, homeopathic treatment. Coming to the homeopathic part, why should you choose homeopathy for your vulvovaginal candidiasis? First thing, it is safe and there is no topical creams that will be given to you, so there is no irritation or redness attached to it. And also in homeopathy, we will be treating the cause as well, that is the hormonal disruption, which is usually hard to treat in allopathic form of a medication. And also by correcting the hormonal imbalance, we will be able to correct the vaginal pH, so that if the vaginal pH is good, then the yeast will not be able to proliferate or multiply. So by decreasing that multiplication, what are we doing? We are decreasing the reoccurrences of the vaginal candidiasis. And also not only that, we will be aiming at your immune system as well. So by increasing your overall health, by decreasing the hormonal disruption or by balancing the hormones and also decreasing the symptomatology, we will be able to cure you, relieve you of your symptoms, and also prevent reoccurrences. So this is the best part in homeopathic treatment. So what should you do if you're suffering from vaginal candidiasis, or what should you do if you don't want to have a attack of vaginal candidiasis? Let us look into the precautionary part. The first thing everyone should do is avoid using any scented diffusers or using any scented tampons or vaginal douches or vaginal cleaning. Do not do a lot of vaginal cleaning. You will cause an imbalance in the vaginal pH. The vagina will get dry and this yeast infection can proliferate. Refrain from wearing tight pants or jeans, as this can cause disruption in the blood flow. And also wear cotton innerwear. Keep yourself clean and dry. By clean, I mean just outer cleaning. Do not do anything with the vaginal cleaning. And also reduce stress and relax so that your hormone imbalance will come to a normal level. And also practice quality personal hygiene and use yogurt, consume yogurt. Remember that certain bacteria are good for your gut as also for your vagina. There are certain bacteria which are normal to the body. By consuming a lot of yogurt or consuming a lot of curd, this good bacteria will get inside your body and your body will be healthy and it will be able to fight the yeast infection or any other differential bacterial infections. Make sure you eat a lot of vitamin C foods like kiwi, oranges, guava, or even any other kind of citric fruits like lemon. So by consuming these, you will help the body to fight against the infection. Coming to the neglect, that is what happens if you neglect this vaginal candidiasis. Remember that usually if you correct your diet, do exercise and take medication on time, we can prevent the recurrences of this vaginal candidiasis. But if you're not taking care of this vaginal candidiasis, it can cause severe dryness, it can cause severe irritation, severe burning and increase in pain during the intercourse as well. And also there will be severe white discharge which will be very irritating to do your normal day-to-day works. Get help as soon as possible, because if you let this Candida albicans or any bacterial infection to stay in the vagina, it can cause systemic infection or your whole body can be infected. So make sure you get help as soon as possible. Coming to the consultation part, if you are viewing this video and you are suffering from vaginal candidiasis or any other female reproductive system diseases and you want to consult us, you can do it in two manners. One is coming and visiting us in person. If you're near the nearest branch of Fidicus, you can come and visit us in person. And if you're far away and you would like to get in contact with us, you can do it through online consultation, which has audio as well as video consultation. After doctor consultation, we will ask you for necessary investigations, or if you have any investigations, you can share it with us. After doctor consultation, our medications will come to your doorstep through courier delivery. If you're staying in India, it will take at least 3 to 4 business days. If you're staying in USA, it can take 3 to 5 business days. And if you're staying anywhere else, it will take 4 to 8 business days for our medicines to reach your doorstep. If you would like to get in contact with us and know about the doctor consultation or more about us, you can call us on this number, WhatsApp us or message us. If you would like to know more about Fidicus Homeopathy, you can check our website www.fidicus.com. If you are suffering from vaginal candidiasis or any other female reproductive system diseases and you are looking for a proper cure, then why should you choose Fidicus Homeopathy? Because Fidicus Homeopathy stands for highest chance of health. Here we follow 3 principles. First is already the cases which are suffering from vaginal candidiasis or any other female reproductive system diseases, we have high success rate in them. And also the transparent treatment, that is, we will be telling you and educating you on the prognosis and what your case is, and also the personal care we take here at Fidicus Homeopathy. If there are any sort of myths that are attached or stigmas attached to your disease, we will be clearing it off and we will be educating you on the disease. So if you want to choose health, if you want to choose cure, choose Fidicus Homeopathy. Thank you.
Fidicus Homeopathy.